Welcome back to part 2 of this episode of Crisis Point. If you haven't already, be sure to check out part 1 on how CKD grew into the public health crisis it is today, the importance of early detection and treatment, and the need for heightened public awareness. Affecting more than 35 million adults in the United States alone, CKD is often underdiagnosed and undertreated, progressing silently until it reaches advanced stages and eventual kidney failure. Catching and treating the disease early is critical for avoiding the need for dialysis and kidney transplant. In addition to early detection, patient-focused multidisciplinary care is essential for improving outcomes. While recent advances in diagnostics, therapeutics, and public awareness efforts offer hope for changing the current narrative around CKD, there is still much work to be done. This is Crisis Point.
So, managing and detecting CKD needs a team approach. Primary care physicians are vital in early detection of CKD because they usually see patients for regular checkups and can do tests such as measuring their glomerular filtration rate and testing urine for albumin. They can also monitor and manage risk factors such as diabetes and high blood pressure because many times patients are referred to specialists only in later stages. So identifying risk factors, identifying patients that have challenges in effective management of these conditions should trigger early referral by the primary care providers. Secondly, coming to nephrologists, the kidney specialists who also play a critical role in really managing chronic kidney disease, preventing its progression, understanding the underlying cause of the disease, and figuring out ways to treat it, whether it is using novel therapeutics, gene treatments, or even sometimes diagnosing undiagnosed kidney disease using novel genetic tests. And lastly, there are a group of physicians and care team partners such as dietitians, obesity specialists, cardiologists, endocrinologists, all of whom have an integral role in not just managing their complication that perhaps is a risk factor for CKD, but really liaising with primary care providers and nephrologists and ensuring that progression of CKD is prevented and that patients don't end up needing kidney transplantation or dialysis.
In many parts of the world, the nephrologists are really they're not enough for them to start managing early stage disease. But what they can do is sort of, provide oversight on programs. So when we're around the world in our programs, which are established in the primary care environment, we have nephrologists that work with us in establishing guidelines and who they can see. So they're a critical part. They're the thought leaders in that particular world, that part of that world, and they know disease in that population, which is different than another population, right? So the demographics, the age, the regions in the country that are more affected by heat stress, genetic predispositions. So they're really key stakeholders in this process, but they're not on the front lines and for the most part can never be in the front lines. So then you really rely on who are the healthcare professional on the front lines. It's not always primary care doctors because they're often unavailable, but of course we engage with them. Nurses are important. Pharmacists are important. Even technologists are important in terms of being available to do some of the point of care testing. And so really utilizing the environments where people like to go. So it's not always even a clinic, right? So it's important for us to be nimble.
Effectively managing chronic kidney disease requires a collaborative, multidisciplinary approach, but it must also be centered around the patient's needs and priorities. Too often, providers operate in silos, resulting in fragmented care for the patient.
I was very scared, and my communication that I received from the provider team was very much dissemination and informational and instructional based only. It wasn't really this partnership and this learning and this kind of tailoring of the care based on the person's lifestyle or goals. I was very challenging. And I mean that as like the verb instead of the adjective, but maybe some providers would say the adjective. I thought that a lot of the standard of care was needing a revamp. I thought that some of these things could be changed to accommodate patients a little bit better. I really blame the system. It's the providers are doing their best. They have metrics that they have to meet. They have to make sure that they're seeing a certain amount of patients per day. Instead of meeting with me for 2 hours to ask them, hey, can you tell me what a KT over V actually stands for? I really try to be a partner, but also was very skeptical. And I just really thought that more people needed to feel that the current system was unacceptable, especially if they did this for a living. Not everyone's as passionate about kidney care as I am, which is fine. We all are different. But I was really challenging the provider team. Hey, we should be asking these types of questions. Why are you asking me this and not this? So I was really trying to tailor my care plan. And towards the end, I was grateful to all the clinicians that worked with me. I still have great relationships with a lot of the nurses that I worked with at my dialysis center. And, have since talked to my dialysis doctor, my transplant doctor that I see every so often, but really my nephrologist post-transplant really is helpful in helping me understand what the labs mean, how they impact each other, and is very welcoming of my questions that seem to be endless. And, really helps me be a provider and encourages, or not a provider, but encourages me to be a partner in my learning and in my care. So it really helps me understand and manage things a lot better.
Effective screening methods, proven therapies, and multidisciplinary approaches that can slow disease progression exist, but need to be used more effectively and equitably. Drug development for CKD is also advancing rapidly, with several new therapies introduced in the past few years and even more on the horizon. By combining innovation with better implementation of existing care strategies, an opportunity exists to change the course of CKD.
The thing that gives me the most hope is this new emphasis on kidney disease. I think there's this wave now of kidney disease concern. I don't know where that initiated from, but it's great. I love this new focus. I still think there's needs to be a lot more, but I love this new focus. I feel appreciative when I have conversations. People know a little bit more than I did 10 years ago about kidney disease. I like the conversations being more commonplace. On the professional side of things, value-based care is huge for kidney care. I really like to focus on clinical outcomes and reducing the cost of care through better quality outcomes and quality of life for the patients. And it's a huge wave and a disruptor of the traditional healthcare system.
Well, I think the most important aspect of kidney disease for me today is why don't we deliver better the evidence we have today to Americans, and how can we do a better job of delivering what we know now? So I think implementation science is exciting. I think health disparities speak to that. So how do we do better for everyone? How do we do better for people who are socially vulnerable? And I think there's a great challenge there. There are multiple clinical trials going on. I think with broader use of some of the medications that we talked about outside of type 2 diabetes. There are a number of trials, so we'll see how those go. There are also some trials looking at the sequencing of the medications. So how do we properly sequence, and can we start 2 of the kidney and cardiovascular protective medications together? Or should we start them in series quickly, or in sequence quickly? And then there are new medications that are coming out that are potentially kidney and cardiovascular protective.
So this is a very exciting time to be in nephrology, honestly. There are several advancements that are likely to significantly not just enhance the quality of life, but actually improve longevity in individuals with CKD. Take, for example, medications. Over the last 5 to 10 years, we've seen several new drugs being approved for preventing CKD progression. We have now SGLT2 inhibitors, mineralocorticoid receptor antagonists, and more recently GLP-1 receptor agonists that can slow progression of CKD. In fact, just last month, the FDA approved semaglutide for preventing CKD progression in type 2 diabetes, which is a really exciting new advance. Secondly, we've really expanded on how genetic testing is being used for CKD. There is a significant proportion of patients who end up with kidney failure who have undiagnosed causes of CKD. And we're now seeing that using genetic testing can actually reduce this pool of undiagnosed CKD and provide prognostication, early identification, and even directing these patients to clinical trials could be an option based on results of genetic testing. So that's something that's really expanding. We are pushing what we can do for home dialysis. There's really a concerted effort to increase home dialysis nationwide because home dialysis offers flexibility, it offers convenience, and is also gentler on the body. So the quality of life of these patients is really better when doing home dialysis. We're also reinventing how kidney transplants are done. There are new organ allocation and matching algorithms. We have new personalized immunosuppressive protocols. And more recently, even FDA-approved trials for xenotransplantation. And so all of these are likely to impact and hopefully improve outcomes for patients who have chronic kidney disease.
Chronic kidney disease has evolved into a full-scale public health crisis, yet it remains widely overlooked. With millions affected and many more at risk, early detection and intervention are critical for slowing disease progression and improving outcomes. Yet too often, CKD goes undiagnosed until its later stages, when treatment options become limited. Raising public awareness and expanding routine screening efforts will be essential in changing this trajectory. CKD no longer has to be a silent, escalating crisis. It can be managed, treated, and in many cases, prevented. A better future for CKD is within reach. This has been HCP Live Crisis Point. Thank you for watching.